Today we are going to highlight the donning and self-doffing process of the high-level PPE ensemble utilized in the Special Pathogens Unit when activated for a high-consequence pathogen. High-consequence pathogens would include viral hemorrhagic fevers, such as Ebola virus disease, Marburg virus disease, Crimean Congo hemorrhagic fever, among others. We will demonstrate the safe donning and doffing process using a trained observer. In the event a caregiver is unable to doff without physical assistance, the trained observer will assist them with doffing their PPE. In that instance, a third caregiver, donned an appropriate PPE, will assume the role of the trained observer. Now we are going to demonstrate the donning process for our high-level PPE ensemble. This PPE ensemble will be worn by any caregiver that enters the patient room when the Special Pathogens Unit is activated. The maximum amount of time a caregiver would be in this ensemble is 4 hours. Our high-level PPE ensemble includes a Maxair PAPR, a belt, a comfort strip, and a battery. We use a single hood Maxair hood, a bouffant cap if needed, a Seotronics radio, battery, and headset, including 2 pieces of foam to cover the mouth and the earpiece, a level 4 coverall, 2 pairs of extended cuff gloves in different colors, a pair of inner boot covers, a pair of external boot covers, and an apron. There will always be a trained observer reading the checklist during donning and doffing, guiding the caregiver through the process. Today, we have Cassie, who will be our trained observer, and Carrie, who will be our caregiver, donning and doffing the high-level PPE ensemble.
Good morning, Carrie. How are you?
I'm good, thanks.
Good. I'm going to be your trained observer today. So that means that I'm going to help you get into your PPE and I'm going to be here along the way. Sound good?
Sounds great.
Okay. I'm going to go ahead and grab my checklist and we'll go ahead and get started, okay? Okay. So today we're going to prepare to don your PPE, and by doing that, you're going to need to remove all your personal items. That includes your watch, your badge, a cell phone, anything that's in your scrubs, jewelry. And it looks like you've already changed into your hospital scrubs and Crocs, so great. And then your hair as well needs to be secured. And if you were wearing eyeglasses, you would secure those as well, just to make sure that you can put those underneath your PAPR. And then you're going to use the restroom if you need to. And then if you don't need to use the restroom, I'll have you go ahead and sign in on the roster and take your temperature. Great. Now we're going to gather your PPE in your proper sizes. So you should have a coverall, a PAPR, a belt and battery, a PAPR hood, a bouffant cap if needed, your inner boot covers, outer boot covers, your extended cuff gloves, and your external extended cuff gloves, an apron, and a Seotronic radio with battery and a Seotronic headset.
Okay.
Do you have everything?
It looks like I do.
Great. So we're going to go ahead and get started. And by doing that, I'm going to have you perform hand hygiene with alcohol-based hand sanitizer. Next, we're going to inspect your PPE and make sure it's free of defects.
Okay.
So you're really looking at the seams there to make sure there's no broken seams or any holes in your PPE. Great. Looks great. So next you're going to apply your belt and your battery, and you're going to apply your belt and ensure your clip is facing up on your waist, and then have a snug fitting and secure the tail of that belt. Great, now you're going to apply your PAPR battery and belt to your left side. Great. Now you're going to test the PAPR function. So you're going to plug in the PAPR, and you're going to ensure that it clicks, and make sure all 3 green lights come on to ensure your PAPR is fully charged. Great. Looks good. Next, you're going to apply the comfort strip to the top of your helmet. Now you're going to look at the fan setting, and there's 3 settings, 1 being the lowest and 3 being the highest. So change that to your desired setting. And then you're going to go ahead and disconnect that battery by pressing the black button and pulling that cord. So next you're going to apply your hood to your helmet and go ahead and set aside. So by doing that, you're going to pick up your helmet, and then you're going to connect the 3 snaps along the front side of the helmet to your hood. Good, you hear those 3 snaps, and then you're going to pull that hood over and ensure it's tight at the front, exposing the Velcro at the front. Great. Now you're going to take your filter and you're going to attach that to the front with the Velcro. So max air to the front, and then pull that tight over the back. Once that's done, we can go ahead and set that aside. Okay, so next we're going to don your radio and bouffant cap. And so you're going to go ahead and grab your radio, put your battery in, and secure that battery to the back. Once that's done, you're going to go ahead and turn that on by holding down the button in the middle until your screen turns on. Perfect. Now you're going to attach your foam pieces to your microphone, and then you're going to attach your headset to your radio, adjust the headset, and apply to your head. Next, you're going to plug that into your radio. Then you're going to put that on your head and test the function. Is it working for you?
I hear it.
Great. Now you're going to clip that radio to the right side of your belt and rotate the radio so the wire points backwards over your right shoulder. Great. And now you're going to don your bouffant cap over that radio. Great. How are you feeling so far?
Good.
Good. So next I'm going to have you take a seat and don those inner boot covers, which are these purple ones right here. Next, you're going to don your coveralls just to your waist, though. Great, now you're going to don your outer boot covers, which are these blue ones right here. Wonderful. Now, since you just touched your feet, I'm going to have you hand sanitize with alcohol-based hand sanitizer. So next we're going to don your papper, and by doing that, you're going to secure the cord under your battery and plug in your cord. Once you do that, you're going to ensure that cord is over the left shoulder, and I'm going to come by and tuck that in the back for you. I also want you to make sure that microphone is in your hood. And now you're going to tighten the knob to make sure it fits properly. Okay, Carrie, I'm going to come by and tuck in your cord for you. Okay. Can you shake your head for me and make sure that fits good? Good. Great. Next, you're going to don your internal gloves. Feel good? Yes. Okay, now you're going to don your coverall, and you're going to pull the cuff of your coveralls over your internal gloves. And then I'm going to assist you in zipping that up and making sure it's secure. Okay. Okay, great. So I'm going to make sure that your Velcro is together, and then I'm going to go ahead and tape you down. Great. And then I want to make sure your finger loops are over your gloves. Now I'm going to come by and secure your hood. So I'm going to tie both sets of ties for you. Okay, I'm going to have you turn around for me and tilt your head up. I'm going to turn back around, and I'm going to get the second tie. They're going to go underneath your arms, and then I'll have you turn again. They're going to go through these hoops right here, at the front. And I'm going to tie these in a bow for you so you can get out of them when necessary. You're welcome. I'll turn and straighten your hood for you. All right, you look great. So next you're going to don your external gloves, and then I'm going to tape them on for you.
Okay.
And let me know if you need help there. I can help you get those extended cuff over the top of your coveralls. Looks great. I'm just gonna straighten these out for you and make sure that you have room to work. And I'm gonna tape these gloves so they're nice and secure. Perfect. Feeling good?
Yep.
Okay. Next, we're gonna don your apron. So I'll go ahead and have you get started, and then I'll help you get your arms into there. Great job. And I'll have you turn for me so I can tie the back of that apron and straighten it out. Okay, and I'll have you turn back for me. And did you get those thumbs in your finger holes?
Yes, I
Great. Okay, so now we're gonna inspect your PPE. And to do that, I'm gonna have you turn in a 360 to make sure everything is covered. You look great. Okay, now I'm going to read you some safety instructions and then you can proceed to the patient care room, okay?
Okay.
All right, so you're gonna keep your hands away from your face, limit the surfaces that you touch, sanitize your gloves immediately if they're soiled, take your time with everything, and the doffing assistant or the monitor will remain visual contact with you at all times. And then you're gonna ask for help or coaching if you need it while you're in the room. If you have a PPE breach, notify the doffing assistant and proceed to the doffing process. And then don't forget to don your third pair of gloves before you start patient care. Okay, Carrie, you look great. So now you're ready to enter the patient room.
Okay.
Okay.
Now we will demonstrate the doffing process. The doffing process will take place in the adjacent doffing room to the patient room or the lab. The trained observer will be in the same PPE ensemble and will guide you through each step of the process utilizing the doffing checklist. The trained observer will read through each step first and then observe you as you perform each step. Remember the following as you proceed through the doffing process. Clear communication is key. Do not proceed to a step until the trained observer instructs you to. Doffing slowly and carefully are important for safety.
Okay, Carrie, thank you for letting me know that you're ready to doff out. I'm gonna have you follow the stop sign above the door and I'm gonna walk you through every step. while you do these steps, I'm going to maintain visual contact with you to make sure everything comes off appropriately. Okay, so the first, I'm going to have you use the mirror, remove your apron starting at your waist, break that apart. Then I'm going to have you cross your arms at the top, break that, turn your sleeves inside out, and your third pair of gloves is going to come off with your apron. You're going to roll that in a ball away from you and discard. Okay, now I'm going to have you perform hand hygiene using alcohol-based hand sanitizer. Next, I'm going to have you obtain a disinfectant wipe so you can wipe down the door and the door handle and then proceed through the door to the red square of the doffing area. Okay, Carrie, now that you're in the red square, I'm going to go ahead and mop the areas where you walked. And I'm going to mop from clean to dirty. Now I'm going to remove the mop head from the mop and discard. Hi, Carrie. How are you doing? Okay, good. This process will be slow and methodical, and I'll walk you through every step. Please do not proceed without my instruction and try to keep your hands away from your face. Sound good? Okay, next I'm going to inspect you for soiling. So if you could lift your hands up and turn in a slow 360 degrees. You look very clean. Now we're going to proceed to the doffing process. So I'm going to have you go ahead and remove the tape on your outer gloves. Then I'm going to have you discard your external gloves using glove and glove technique. And then you're going to perform hand hygiene using alcohol-based hand sanitizer. Okay, next we're going to remove the tie. And I'm going to have you use the mirror as necessary. And you're going to untie your papper hood just at your waist only and then gently discard that tie. And then I'm going to have you perform hand hygiene. Next, we're going to get ready to doff your coverall. So by doing that, I want you to reach under your hood and find your belly button with both hands. You're going to untape, so expose your zipper by moving down to the bottom and then up to your neck. A little bit to your right. There you go. And then you should find that Velcro at your neck and unvelcro. And then go ahead and unzip that coverall. Perfect. Now you're going to grab the back of your coveralls and shimmy them off your shoulders and down to your waist. You're going to remove your arms from your sleeves, turning them inside out and touching the inside of that coverall only to contain your coveralls. And I want you to go ahead and use the stool as necessary as you roll your coveralls down. And then you're going to remove your outer boot covers with your coverall. Again, touching the inside only, rolling them into a small ball and gently discarding your coveralls. Great. Now I'm going to have you perform hand hygiene. Next, we're going to go ahead and untie your necktie, and I want you to use the mirror as necessary. Untie, remove, and gently discard. And perform hand hygiene. Next, I would like you to doff those gloves using glove and glove technique and gently discard. Then I would like you to perform hand hygiene using alcohol-based hand sanitizer. And you can go ahead and face me. And then there's a pair of new gloves right behind you on the cart, and I'm going to have you don a new pair of gloves. Okay, so next we're going to remove your hood from your PAPR helmet. So by doing that, I want you to leave your helmet on your head, remove the hood from back to front in the following manner. Use both hands, reach under the hood to the back of the helmet and fold hood over filter, completely covering the filter. Then I want you to remove your hood from back to middle of helmet at your ears. Unsnap the visor from the two side tabs, fold visor together, and unsnap center tab. Then you're going to discard your hood, touching the inside only. Great, now I want you to perform hand hygiene. Next, we're going to doff your inner boot cover. So I want you to go ahead and take a seat on the stool in the red square. And you're going to remove the first boot cover closest to the yellow square, which would be your right foot. You're going to touch the inside of the boot covers only. Place foot into the yellow square without setting foot down in the red square after you doff that boot cover. Great. And then you can proceed to the second foot in the same manner and place foot down in the yellow square, remembering not to touch the red square with your foot after you've discarded. Perfect. You can go ahead and now stand up in the yellow square. I want you to go ahead and use this hand hygiene and perform hand hygiene. Next, we're going to doff your PAPR and your battery. So I want you to turn around and face the cart behind you. Loosen the knob on your PAPR. Bend forward and remove the PAPR from the left side and place in the red bin. Then I want you to unplug the cord from the battery, contain your cord, and place that in the red bin. Then I would like you to remove your bouffant cap, discard, Now I want you to remove your radio with headset. So if you're wearing your radio, remove the headset and place in the bin labeled for headset, which is up to your left. Now you're going to remove your belt with your battery and place in the red bin. Perform hand hygiene behind you. And then I want you to doff those gloves using glove and glove technique. Now that you have doffed all of your PPE, you can proceed to the green, and I want you to go over to the sink and wash your hands up to your elbows with soap and water before leaving the doffing room. Carrie, now that you've washed your hands up to your elbows, you can proceed out of the doffing room and follow our comfort shower process.
After the doffing process is complete, the trained observer will mop the floor from clean to dirty, allowing for the proper contact time with the disinfectant. Once the contact time is complete, the trained observer will continue with the cleaning process of the doffing area. First, they will remove the papper, belt, and battery from the red bin and disinfect them with wipes. They will then place them in the plastic bag-lined blue bin on the doffing cart. They will proceed with wiping down the radio and headset and set them in the clean bin with the papper. Then they will proceed to disinfect the chair, stool, hand sanitizer, and other surfaces that the caregiver could have come in contact with. Once the cleaning process is complete, they will process waste according to our waste processes. Maintaining a culture of safety for our special pathogen team members is one of our highest priorities. Essential components of this process are utilizing the established checklists with a trained observer, donning and doffing in a slow, methodical manner, and a dedication to teamwork to ensure a safe care environment. Thank you for your commitment to the Special Pathogens team, providing excellent care and keeping our patients and each other safe.